Welcome everyone to the How to Become a Doctor series. We're very glad you're here. You can meet with us for advising in Hatcher anytime. You can sign up through Navigate, through pre-med, prevent, dent advising. My name is Matt Duris. I'm one of the pre-health advisors. I'm here with Mr. Robbie Bowen, our director of pre-health, and we do the advising for all medical, dental, optometry, podiatry students on campus. Whatever your major is, you can meet with us. We want to help you. And so we've been doing these How to Become a Doctor series just to be able to create more content for you guys. We can't hit everything in a 30-minute appointment with you all, but we can record these different topics, and then if you watch them, you can come in and ask extra questions. And so our topic today is about funding your medical, dental, optometry education. And Mr. Bowen and I are not what we would call experts on this topic, right? Because we are experts on the pre-med side, but we do want to just show you the right places to look at resources and point you in some directions to let you know that if you're intimidated by the price of medical school, there is options out there, for scholarships, and then especially for loans, but even more, even for a lot of loan repayment options. And so, if you're looking to get those loans paid off quickly or have help with them, there's a lot of options for that after you graduate medical, dental school. And so, I actually we have our pre-health Moodle page. Many of you are aware of that, but that's what I'm going to go to right here. I'm going to reference back to it, right? So we have our pre-med website. If you go to lsu.edu/science, and then under student services, hit pre-med, pre-dental resources, you'll come to this website. You can join our phase Moodle page right here. And we've been trying to highlight a lot of the topics discussed on the Moodle page in these seminars. And so, of course, you can watch our recordings of the seminars at How to Become a Doctor series, but I actually just created a new tab here for you, funding medical dental school. And so, the first question we have is, how can you pay for applying to medical school? This is actually something called the Fee Assistance Program through AAMC. We have a link right there. And if you go to that Fee Assistance Program, you can see that if you qualify for it, then you can actually have your application to medical school be free. A lot of secondaries will get waived. You can apply up to 20 schools for free. You also can have a discounted MCAT. You get free MCAT prep products, free access to MSAR, which we've highlighted in other episodes. And then as well, they'll do if you need to get just a psych evaluation for accommodations with MCAT, they will cover that. So that's a great thing to check out. So look at that. But also, AACOM, the osteopathic application, also has a fee application waiver. And so those are two ways to be able to fund applying to medical school. But we do want to talk especially today about how do you pay for actual medical school, right? And so, we will, of course, want to bring you, if you watched our episode on where to find good resources, episode 3, you're going to see that we brought you a lot of the resources that AAMC. And why is that? Because AAMC is over the medical schools. This is where you register for the MCAT. This is where you would apply to any allopathic schools. So anything on their website is going to be good, right? There's a lot of websites out there. We said you can't trust every resource, but pretty much if it's on this website, if you see AAMC at first, it's going to be good. And they have a student and residence tab. So that's what I'm looking at right now, is looking at the AAMC website. Under the student tab, they have a financial aid application process. And so if you go to any medical interview, they're going to have some sort of financial aid office meeting or training, but you might want to, start looking at this now. And so this kind of walks you through, investigating the sources of aid, completing your FAFSA, applying early to your loans or to scholarships, that kind of thing. And then, being aware of, as you choose what schools, what they are. So, definitely check out, the resources at AAMC, but I especially want to highlight one of their tabs, which is, paying for medical school through service. And so one big way, of course, to fund medical school outside of loans is going to be loan repayment options. So what happens is, you get into medical school, you take those loans out, and you leave medical school, and all of a sudden you have, high bills, right? A lot of loans coming your way. And so, how do you get those paid back? Well, like I said, one of the ways is through service. If you have a federal loan and you want that federal loan paid back, there's a few different things out there. You do have the public service loan forgiveness, and this is one that will count for your undergrad loans and your med loans, and this is one where you do have to pay for your loans for 10 years. So it may not be your first option, but if you work for a government agency, for a qualifying nonprofit, for an educational institution that's under the government list, then after your 10 years of paying your loans off, your 120th online on time payment, which will probably be online, then they will waive the rest of your loans. So that's one thing to check out. Like I said, we're not going to cover it intensively. I'm just trying to highlight those. So check out that one. But another neat one, which you may not be aware of, is the National Health Service Corps. So, many of you guys, hear physician shortage, right? And we're living in the city. We're a little confused about that word because we see plenty of physicians in the city, but there's many places in the country that don't have many physicians. And so, especially if you end up doing a residency in a more general practice setting, then you can look for jobs. After you're licensed as a physician, you can look for jobs under NHSC, and if you take this job, they will forgive your loans up to $120,000. You can see here, depending on the program where you're going to go. And so you can, the benefit of this is you can look around at jobs, and if you find one that qualifies for this, you get to choose that job, choose that place, you take it. They pay you a salary, plus they pay off your loans because there's a need of a physician over there. And then you're not committed to 4, 5, 10 years. Typically it's a shorter commitment. You can do more years, but for however long you commit, they'll pay off. And so, like I said, the good news is you're not tied into it. You're not committed to it, and it's not paying, you don't have to pay 10 years like the public loans forgiveness, but it's a way for you to get that loan repayment back. Of course, another one you all are probably aware of or thought of in the back of your mind is military service. This is not for everybody, but if you find a calling to go to the military, of course they need physicians and dentists and optometrists. And so if you can get into medical school, or if you're applying to medical school, you can reach out, and once you're applying, they can help you with that process. Excuse me. So, next I want to talk about just state and federal programs. So, just want to highlight the fact that, there's a lot out there, and some of you aren't from Louisiana. So look at this list, click it, and you can see all the different ones from maybe states you're from or different areas. You can see Louisiana on there, and there'll be more loan forgiveness programs out there. Here's some of the armed forces ones. So definitely check that out. So, I'm going pretty fast, but my whole point is, look at those fee assistance programs for applying. Look at AAMC and AACOM's website for these, the loan application process, but also, the loan forgiveness opportunities. And then, also, we didn't look at AACOM for the osteopathic schools. You can definitely look at their website. And so, if we look here, they have scholarships as well, right? There's a lot of scholarships out there. We encourage you to just, Google, look at scholarship school. But, the osteopathic schools have some official scholarships, so I encourage you to check those out. Some for minorities, they have some loan repayment ones there. And then also you can see just some different foundation scholarships they have through here. They highlight a few more programs like the VA program to be able to get funding by serving the VA, the Indian Health Service program by funding, you get funding by serving in an area where there are American Indians or Alaska Natives. We already talked about NHSC, but then also there's a White House initiative on historically Black colleges and universities. So, we don't have all the time to touch on that today, but we just want to let y'all know that, you don't have to do the traditional route of taking out loans and paying them back dollar for dollar. That if you're willing to, work in a certain area where there's a need of physician, if you're willing to apply to some scholarships, if you're willing to, sign up to work in the Army, for the Navy, and there's a lot of options out there. And just to let you know, like things like Navy, Army, they're going to pay your tuition up front. And then for however many years they pay your tuition, you would serve them in that branch. And there's many branches of the armed forces you're not aware of. It's not just Navy, Army, and Air Force. There's also some national service branches as well that you could work with. So, like I said, check out those assistance programs for applying to medical school through both allopathic and osteopathic. Check out the allopathic and osteopathic websites for a lot of loan repayment programs. And then the last thing we want to highlight is check out individual schools for the programs they have. And so I'm going to highlight two of those today. The first one's at LSU New Orleans. They do have a rural scholars track. And so, if you go to LSU New Orleans and you designate that you're interested in this program, they will actually, waive your tuition if you're willing to do family medicine and serve in rural areas, Louisiana. So the benefit of something like this is that they waive your tuition, but then just know when you graduate, they're going to be placing you in a certain area that does need a physician. So you give a little bit of your time. They give you financial assistance for that. And another program out there as well is just another school program is the Geysinger School of Medicine. This is a school up in Scranton, Pennsylvania. It is a private school, so as a Louisiana resident, you're not disadvantaged applying up there since it's not a public institution out of state. But they have a similar program. They have a hospital system, and so what you would do is you go to medical school, get into this program at Geysinger, and then you would let them know you're interested in this program here, where you do choose a specialty, do a residency in a more general area such as internal med, peds, family med, something like that. And you, for every year that they waive your tuition for medical school, you would serve them in their hospital system. They would place you in one of their places in rural New York or Pennsylvania. And you can see they even give you a stipend. You don't have tuition debt. You can see here, they said family med, medicine, peds, as we said, psychiatry, internal med. And then, 1 year of service is 1 year support with a 2-year minimum. So, that's our point is, we can't spend all the time here talking about every program there is out there, but, we want to encourage you guys, do your homework now, because this may help you as a junior if you're deciding what schools to apply to. If you can look into the funding, you can see that there's some opportunities out there that maybe that school that you thought was too expensive for you, now you can afford because you're going to, join the military, or you're going to, do a loan repayment program, or maybe you could apply for some of those scholarships, especially if you're a minority, or you could, like I said, look into one of these specific school programs like LSU New Orleans Rural program, like the Geysinger program. There's a lot out there. And so we'd love to talk to you about this. If you're intimidated by that price, if you're already carrying a lot of loans from undergrad or from doing, a master's degree afterward, we want to help you get there. And so that's just a highlight. I do encourage you to go to our Moodle page and you can see, all these sites that I just referenced, all of them I did put on that Moodle tab for, funding med and dental school. But just reach out and schedule an appointment if you have any questions. We want to be as helpful as we can with what we can answer. So that's the content I have for today. Like I said, I know it's a flyover, but hope that you guys do some extra research. But I do want to open up to any questions we have, or any pre-prepared questions we had.
Yeah, before we do that, I just want to point out that we talked about medical school, but if you're dental, they have the same fee assistance program from the American Dental Education Association. Just about any of the health profession scholarship application services, there's some kind of like a fee waiver or some sort of program that you can apply for to help you cover some of those application costs. They usually extend to the admission test and some other opportunities. They're all a little bit different, but if you're dental or your optometry or whatever, those programs are available as well for your application service. You want to go ahead with some questions?
Yeah, let's go with some questions.
So one question is asking about if you're a Louisiana resident and can you use, if you don't use all of your TOPS at your undergrad, can you use that for medical school at LSU's medical schools?
Yeah, that's a great question. You may have just been at LSU, for 7 semesters, not 8, or just 6 semesters, not 8, and you didn't use your full tops, or you're wondering, hey, should I graduate early? Might as well use up tops if I have it. Well, I'm just going to pull up straight to their website to answer this question. Will tops pay for graduate professional school? The answer is yes. If you're a Louisiana resident, you're at a Louisiana school, it will pay for it. But do want to encourage you to read. Just the eligibility here. They say that you need to be in that school no later than the fall semester following 1 year anniversary or completion of your undergraduate degree. So make sure you'd be entering medical school pretty quickly there afterward. And then also you need to be, you can see that they mentioned the medical there, of course, dental school, all that. And then they tell you exactly what payment you get. And so if you're in a private professional school, they'll divide the total dollar amount of public post-secondary institutions. And then kind of same thing if you roll in a graduate degree program at Louisiana College University, it'll be equal to the tuition charged of just a student at the highest cost of public school in the state. So the whole point is that if you're at private, they're going to give you some funding, probably the average. It looks like it's the average of undergrad tuition towards that year. And then if you're at a public school, LSU, New Orleans Med School, Dental School, or LSU Shreveport, they're going to basically give you, whatever the highest cost of undergrad would be, that they'll give you that funding towards your tuition.
So also, if you're online, you can put any questions that you have in the chat box, and we'll get to those too. Another one that we have prior to starting is when they're asking about timing of terms of like, when should you start thinking about financing your professional school? Like, when should you start doing that and start looking around for opportunities and scholarships?
Yeah, it's a great question. In one sense, it's never too early to look at this. Just because that is something to consider. If you're making this investment, even as a freshman, if you're going to be choosing your major, about what to study, you're going to want to know the cost. What's it going to cost if you're studying biology because you want to be a physician? What's it going to cost? On the way to become one. But in the same sense, especially that junior year or senior year when you're getting ready to apply, that's really important because it might change, what schools you apply to, depending on the tuition, depending on the scholarships out there. But especially senior year, or just your application year, you're going to have time to research, to look, to apply to things. So maybe you're too busy your application year and you're just focused on, your MCAT and your application. Once you submit that AMCAS, that ADSAS, then you could, really deep dive and just start researching. Google programs, look at our link on our Moodle page, come talk to us, talk to the admissions websites. The admissions programs of the medical schools you're interested in, or look on their websites. And we'd love to help you with that.
Yeah, I think definitely starting early is the key. I think that, you want to start planning, how most people are going to go to med school with loans, and they're going to come out of med school with loans. That's just kind of sort of the way that it happens, but you can definitely start as early as possible, at least researching. I mean, just Googling medical school scholarships, dental school scholarships, and you'll get a lot of resources that you can start looking into, maybe making some notes about, timelines and when you need to do that. Matt mentioned that you're going to get an financial aid overview when you go to a professional school for the interview. Part of the interview day is meeting with the financial aid directors at the school. They're going to go over all of the programs that they participate in, lenders, loan options that they already have partnerships with. And so you'll get a packet of basic information, about, what it's going to cost you and how you can start paying for it. And then once you get accepted, you'll get, more information about, getting started on that process. And I think that, if you get into medical or dental school, they're going to make sure that they help you find a way to pay for it. And so they'll work with you. They'll, help you, point you to, people that they already have relationships with in terms of lending programs and things like that. So, I know it's daunting when you think about, the numbers and the financing that much educational cost. But they will help you, and they will make sure that no one is, that you're not going because you can't pay for it. They'll help you find a way to make that happen.
Well, yeah, and Robert, why don't you mention, some of the costs outside of, just tuition, that someone would have to think about if they're going to dental, optometry, medical school?
Well, I think up front people forget, the last couple of years, interviews have been virtual because of the pandemic. But in a typical application cycle, you have to think about, the travel expenses of traveling to the school. If you're interviewing around the country, that's going to be airfare, that's going to be lodging once you get there. Most schools will help you find places to stay. They have students who volunteer to let students stay with them while they're there interviewing, or they'll help you try to find a place to stay. But you have all those costs that I think people sometimes forget about, in terms of upfront before you even get there. So you want to make sure that you're taking that into account. If I want to apply to all the schools in New York or Chicago, I have to think about travel expenses to get there, food and all the stuff that goes into that to get there. The other cost that you have to think about is, you can't work while you're in medical or dental school for the most part. I mean, you're pretty much a full-time commitment in medical and dental school. There are students who do manage to, moonlight and do some stuff here and there, but it's very rare. And the amount of time that you're going to have to be spending in the medical and dental school, academic part of that, you're going to need to be able to pay, have a way to live. So living expenses, um, transportation costs, all of those things that are on top of the tuition. So when you think of tuition as, a number they give you, $16,000 or whatever it is, that's just the cost of the school. That doesn't account for, living in the city, and the transportation and food and all the other stuff that you have to do. And so, that's where scholarships like from the military can be really helpful, because they give you a monthly stipend. They pay for all of your tuition and fees. And then you also have the stipend that helps you pay your monthly rent and your transportation costs and food and things like that. So, so you do have to take those considerations and get that into consideration. Like, if I'm going to go somewhere in a large city, the cost of living is going to be much more expensive than if I'm, going to Shreveport or something. And so, all of those are factors that you should be considering when you're picking out your target schools. Not only do I have to pay for the tuition, but the living there for 4 years, or however how long I'm going to be there, is definitely something that you have to take into consideration.
Yeah, and you mentioned our LSU schools. Just if you are a Louisiana resident, you're basically getting half off tuition. So it's kind of standardly, most medical schools are around 60,000, give or take, a year of tuition. So multiply that by 4 years, multiply that by loans. But the LSU schools, at least medical wise, are around closer to 30,000, about half off there. So there is that benefit of if you're from another state, you're going to have in-state tuition, at your state school typically. And so that is going to be just a helpful thing to think about. Doesn't mean you have to go to your in-state institution, but it definitely is something to think about, because also, once you graduate from medical school, you can choose to move to San Fran, move to Boston. But at that point, the current will switch, and instead of you paying them, they'll start paying you. And that's going to be, obviously what you guys are looking forward to. But just, you can look on the MSAR, data to see the tuition for each school, and they'll let you know that.
Yeah, and they'll give you like a breakdown of the average cost of living. And so when you go to that school, they're going to tell you that, we recommend that students account for this much money for their annual living expenses on top of the tuition. So they'll give you a breakdown, and you'll know exactly what you're going to need to live. And it's really up to you, like how much sacrifice are you willing to make, because I think a lot of students take out a lot more money than they need. And so it's, it comes down to you. Like, I'm willing to live very frugally, and I'm living, in I'm living at home or I'm doing things like that, that I can to cut expenses as much as possible. You know, but it's definitely something, no matter if you're freshman, sophomore, junior, that you want to start thinking about, start researching, start looking for opportunities, that scholarships that you can apply for from the private sector, not just from the schools.
It's good. Okay. Do you have any more questions?
I think that's all we got.
Okay, yeah, well, look, thanks for watching this one, everybody. And, like I said, just want to encourage you guys, to not be too overwhelmed by this. The whole idea, as Mr. Bowen mentioned, is that you need to focus on getting in. If you get in, there's going to be a way to fund it. But at the same time, so don't get stressed out by the financial piece, and of course, it's a great investment because you will end up, making that money more than you'll owe and pay it back. But, just on the other side is, it is not ever too early. And so I encourage you guys to have the whole picture of what you're going into, realize that this is a commitment and a journey, and you kind of have to go down to go up. And so, as Mr. Bowen mentioned, we encourage you guys to, minimize debt, try to go down less so that you can go up higher, and just use your resources and plan a little bit ahead, and really open doors. So anyways, we're glad you joined today, whether, in person, live, or you're watching the recording. And we just want to invite you out in 2 weeks from now. We're going to be discussing osteopathic medicine, but, I believe it would be helpful, even if you're dental, even if you're, just interested in allopathic, to come check it out. We're going to be interviewing someone discussing their journey to osteopathic medicine. So thanks again, and we'll see you at the next one.
Thanks.